Question 1. A nurse is caring for a client with a history of heart failure and chronic kidney disease. The client's morning lab results show a serum potassium level of 6.2 milliequivalent/L and a creatinine of 3.8 mg/dl. The client is asymptomatic. Which of the following is the most appropriate initial nursing action? A. Administer a prescribed loop diuretic. B. Prepare to administer insulin with dextrose. C. Encourage increased oral fluid intake. D. Restrict dietary sodium and potassium. Answer B. Prepare to administer insulin with dextrose. This question tests the nurse's understanding of managing hyperkalemia, especially in the context of chronic kidney disease, where the body struggles to excrete potassium. A serum potassium of 6.2 milliequivalent/L is critically high and can cause life-threatening cardiac dysrhythmias, even if the client is currently asymptomatic. Administering insulin with dextrose is a rapid-acting intervention that shifts potassium from the extracellular space into the cells, temporarily lowering serum potassium levels and protecting the heart. While dietary restrictions and diuretics, if kidney function alloid, are important long-term, they are not immediate life-saving interventions for acute severe hyperkalemia. Increasing oral fluid intake would not effectively address high potassium. Remember, always prioritize interventions that stabilize a critical lab value that could lead to cardiac arrest. Question 2. A nurse is assessing a client admitted with an exacerbation of myasthenia gravis. The client's respiratory rate is 28 breaths/min, shallow, and oxygen saturation is 88% on room air. The nurse observes paradoxical abdominal breathing. Which of the following is the priority nursing intervention? A. Prepare to administer pyridostigmine. B. Elevate the head of the bed to 45 degrees. C. Initiate non-rebreather mask at 10 to 15 liters per minute oxygen. D. Notify the healthcare provider and prepare for intubation. Answer D. Notify the healthcare provider and prepare for intubation. This question evaluates the nurse's ability to recognize and prioritize interventions for acute respiratory failure in a client with myasthenia gravis, a neuromuscular disorder characterized by fluctuating muscle weakness. The client's signs, rapid, shallow breathing, low oxygen saturation, and paradoxical abdominal breathing, are clear indicators of impending or actual respiratory failure, a myasthenic crisis, requiring immediate advanced airway management. While oxygen is helpful, it won't resolve the underlying ventilatory failure. Pyridostigmine, a medication for myasthenia, takes time to act and can sometimes worsen secretions if the client cannot clear their airway. Elevating the head of the bed is a supportive measure, but does not address severe respiratory distress. The priority is to secure the airway and support ventilation, which often means intubation, so the healthcare provider must be notified immediately to prepare for this life-saving intervention. When managing respiratory distress, remember that severe, shallow breathing combined with paradoxical movement indicates muscle fatigue and imminent collapse, demanding rapid action for airway protection. Question 3. A client with a traumatic brain injury has developed syndrome of inappropriate antidiuretic hormone, SIAD. The nurse anticipates which of the following fluid management strategies? A. Administration of 0.9% sodium chloride intravenously. B. Strict fluid restriction. C. Rapid infusion of hypotonic saline. D. Administration of a loop diuretic with potassium supplementation. Answer B. Strict fluid restriction. This question assesses knowledge of SIAD management, a condition where the body produces too much antidiuretic hormone, ADH, leading to water retention and dilutional hyponatremia, low sodium. the most critical intervention for SIAD is strict fluid restriction, which helps the body excrete excess water and normalize serum sodium levels without further diluting the blood. Administering 0.9% sodium chloride, while isotonic, would add to the client's total body water and worsen the dilutional hyponatremia. Hypotonic saline would further dilute the client's sodium, and loop diuretics are generally used cautiously and often in conjunction with hypertonic saline for severe cases, not as the primary initial strategy for fluid management in SIAD alone. Remember, in SIADH, the core problem is too much water, so limiting water intake is key. Question 4. A 6-year-old child with a ventricular septal defect, VSD, is admitted with signs of heart failure. The nurse notes a respiratory rate of 50 breaths/min, nasal flaring, and grunting. The parents report the child has been feeding poorly and has decreased wet diapers. Which of the following is the priority nursing action? A. Administer digoxin as prescribed. B. Elevate the head of the bed. C. Administer furosemide as prescribed. D. Implement comfort measures to reduce crying. Answer: B. Elevate the head of the bed. This question tests the nurse's ability to prioritize interventions for a pediatric client experiencing acute respiratory distress secondary to heart failure. While digoxin and furosemide are important for heart failure management, the immediate priority for a child with a respiratory rate of 50 breaths/min, nasal flaring, and grunting is to improve breathing effort and oxygenation. Elevating the head of the bed helps reduce venous return to the heart and lungs, easing the work of breathing and improving lung expansion, which is an immediate, non-pharmacological intervention. Administering medications takes time for onset of action, and while important, the client's acute respiratory distress needs an immediate physical intervention first. Reducing crying is important but not the priority over respiratory compromise. Always prioritize airway and breathing when a child shows signs of significant respiratory distress. Question 5. The nurse is caring for a client with end-stage liver disease who is experiencing ascites and hepatic encephalopathy. The client's ammonia level is significantly elevated. Which dietary modification should the nurse anticipate for this client? A. High-protein, low-sodium diet. B. Low-protein, low-sodium diet. C. High-carbohydrate, unrestricted protein diet. D. Low-fat, high-fiber diet. Answer: B. Low-protein, low-sodium diet. This question assesses the nurse's understanding of dietary management for clients with end-stage liver disease, specifically when hepatic encephalopathy and ascites are present. Hepatic encephalopathy is caused by the liver's inability to metabolize protein byproducts, leading to an accumulation of ammonia. Therefore, a low-protein diet is crucial to reduce ammonia production. Ascites, which is fluid accumulation in the abdomen, is managed with a low-sodium diet to prevent further fluid retention. A high-protein diet would worsen encephalopathy, and while carbohydrates are important, protein must be managed carefully. A low-fat, high-fiber diet is generally healthy but not specifically targeted at the primary issues of ascites and encephalopathy. Always remember to restrict both protein and sodium in advanced liver disease with these complications. Question 6. A client admitted with a severe gastrointestinal bleed is receiving a massive transfusion protocol. The nurse observes muscle twitching, numbness, and tingling around the mouth. Which of the following laboratory values should the nurse immediately anticipate being abnormal? A. Serum potassium. B. Serum calcium. C. Serum magnesium. D. Serum sodium. Answer: B. Serum calcium. This question tests the nurse's knowledge of potential complications of massive blood transfusions. Massive transfusions involve administering large volumes of blood products preserved with citrate, an anticoagulant. Citrate binds to ionized calcium in the client's blood, leading to hypocalcemia, low calcium. The symptoms described, muscle twitching, numbness, and tingling, paresthesias, around the mouth, are classic signs of hypocalcemia. While other electrolyte imbalances can occur, hypocalcemia is a distinct and common complication of massive transfusions due to citrate toxicity. Always remember that citrate in banked blood can chelate, bin calcium, leading to a sudden drop in a client's calcium levels, especially with rapid transfusions. Question 7. A client is admitted to the emergency department after a motor vehicle crash. The client has a suspected C6 spinal cord injury. Which of the following findings is the most concerning and requires immediate intervention? A. Bradycardia with a heart rate of 45 beats/min. B. Blood pressure of 88/50 mmHg. C. Absence of deep tendon reflexes in the lower extremities. D. Priapism. Answer B. Blood pressure of 88/50 mmHg. This question assesses the nurse's ability to prioritize signs of neurogenic shock, a life-threatening complication of spinal cord injury, particularly in the cervical or upper thoracic region. A blood pressure of 88/50 mm of mercury indicates significant hypotension, a hallmark of neurogenic shock, which results from the loss of sympathetic tone causing widespread vasodilation and relative hypovolemia. While bradycardia, a heart rate of 45 bpm, and priapism, persistent erection, can also be signs of neurogenic shock, profound hypotension directly compromises tissue perfusion and is the most immediate threat to organ function. The absence of deep tendon reflexes is expected with spinal cord injury but not an immediate life-threatening finding. When assessing a client with a spinal cord injury, remember that hypotension indicates a critical lack of tissue perfusion and requires rapid fluid resuscitation and possibly vasopressors to maintain vital organ function. Question 8. A nurse is preparing to administer phenytoin to a client with a new order for continuous enteral tube feeding. Which of the following actions is essential to ensure proper medication absorption? A. Administer the phenytoin with grapefruit juice to enhance absorption. B. Dilute the phenytoin in a large volume of water and administer rapidly. C. Hold the enteral feeding for 1 to 2 hours before and after phenytoin administration. D. Administer phenytoin crushed and mixed with the enteral formula. Answer C. Hold the enteral feeding for 1 to 2 hours before and after phenytoin administration. This question tests the nurse's understanding of the unique drug-food interaction between phenytoin and enteral tube feedings. Phenytoin absorption is significantly reduced when administered concurrently with enteral tube feedings due to the binding of the drug to protein in the feeding formula, leading to subtherapeutic levels and increased risk of seizures. It is essential to hold the enteral feeding for 1 to 2 hours before and after administering phenytoin to allow for adequate absorption. Grapefruit juice does not enhance phenytoin absorption and can actually alter its metabolism, while crushing and mixing it with formula will reduce its efficacy. Rapid administration or dilution does not address the interaction. Always remember that phenytoin absorption can be significantly impaired by tube feedings, requiring a pause in feeding to ensure proper drug levels and seizure control. Question 9. A nurse is caring for a client with a chest tube following a pneumonectomy. The nurse notes continuous bubbling in the water seal chamber. Which of the following is the most appropriate initial nursing action? A. Clamp the chest tube immediately to prevent air entry. B. Increase the suction to 40 cm H2O. C. Assess the client's respiratory status and the chest tube insertion site. D. Document the finding as normal for a pneumonectomy. Answer: C. Assess the client's respiratory status and the chest tube insertion site. This question assesses the nurse's critical thinking regarding chest tube management, specifically after a pneumonectomy, which is the removal of an entire lung. After a pneumonectomy, continuous bubbling in the water seal chamber is not a normal finding. It indicates an air leak, which can be life-threatening. The most appropriate initial action is to assess the client for signs of respiratory distress and then systematically check the chest tube system, starting from the insertion site, tubing connections, and then the drainage system, to locate the source of the leak. Clamping the chest tube without locating the leak can lead to a tension pneumothorax on the remaining side if the leak is within the client, and increasing suction will not resolve the leak. Documenting it as normal would be incorrect and dangerous. Always remember that continuous bubbling in the water seal chamber after lung removal, or any time it's not expected, like after initial placement for a pneumothorax, means you need to find and fix the air leak immediately. Question 10. A client with a long history of poorly controlled type 2 diabetes mellitus is admitted with new onset of right foot pain, swelling, and redness. The nurse notes a small ulcer on the plantar surface. Which of the following actions is the priority? A. Obtain a wound culture. B. Administer broad-spectrum antibiotics. C. Elevate the affected extremity. D. Assess for signs of systemic infection. Answer: D. Assess for signs of systemic infection. This question tests the nurse's ability to prioritize assessment in a client with diabetes who is at high risk for infection complications, specifically a diabetic foot ulcer. While obtaining a wound culture and administering antibiotics are crucial, the most immediate priority is to assess for signs of systemic infection, like fever, chills, tachycardia, leukocytosis, that could indicate cellulitis, osteomyelitis, or even sepsis. An untreated or rapidly progressing infection in a diabetic client can lead to amputation or death. Elevating the extremity might be helpful for swelling but isn't the priority in the face of potential systemic infection. Identifying systemic involvement guides the urgency of treatment and further diagnostics. Remember, in diabetic foot ulcers, infection can spread rapidly and become life-threatening, so assessing for systemic signs is the first step toward appropriate and timely intervention. Question 11. A nurse is caring for a client with hepatic encephalopathy. The client is prescribed lactulose 30 ml orally 3 times a day. The nurse understands that the effectiveness of this medication is best evaluated by which of the following? A. Decrease in serum ammonia levels. B. Improvement in hysterexis. C. Increase in the number of bowel movements. D. Resolution of jaundice. Answer: C. Increase in the number of bowel movements. This question assesses the nurse's understanding of the expected therapeutic effect of lactulose in managing hepatic encephalopathy. Lactulose works by lowering ammonia levels in the blood primarily by promoting its excretion through the feces. It creates an acidic environment in the colon, which traps ammonia ions, and acts as an osmotic laxative, increasing bowel movements to expel the ammonia. Therefore, an increase in the number of soft, loose bowel movements, typically 2 to 3 per day, is the most direct and observable indicator of effective lactulose therapy. While a decrease in serum ammonia levels and an improvement in hysterexis, flapping tremors, a sign of encephalopathy, are ultimate goals, the direct effect that indicates the medication is working as intended is the increase in bowel movements. Jaundice is related to bilirubin, not directly treated by lactulose. Remember, more frequent bowel movements are the immediate sign that lactulose is doing its job of clearing ammonia. Question 12. A client with an exacerbation of ulcerative colitis is experiencing severe abdominal pain and frequent bloody stools. The nurse observes a rigid, board-like abdomen and absent bowel sounds. Which of the following is the priority nursing intervention? A. Administer a prescribed opioid analgesic. B. Prepare for immediate surgical consultation. C. Administer intravenous corticosteroids. D. Obtain a stool sample for culture. Answer: B. Prepare for immediate surgical consultation. This question tests the nurse's ability to recognize a critical complication in a client with ulcerative colitis and prioritize the appropriate action. A rigid, board-like abdomen with absent bowel sounds in this context is a classic sign of peritonitis, often due to toxic megacolon or bowel perforation, which are life-threatening emergencies. These findings indicate an acute abdomen requiring immediate surgical intervention. While pain relief and corticosteroids are part of managing ulcerative colitis, they do not address the acute surgical emergency. Obtaining a stool sample is not the priority when perforation is suspected. The nurse must act quickly to notify the healthcare provider and prepare for surgery. Always remember that a rigid, board-like abdomen suggests peritonitis or perforation, demanding immediate surgical evaluation. Question 13. A client is receiving a continuous infusion of vasopressin for esophageal varices. Which of the following adverse effects should the nurse monitor for most closely? A. Hypoglycemia. B. Peripheral edema. C. Myocardial ischemia. D. Hypernatremia. Answer: C. Myocardial ischemia. This question assesses knowledge of the serious adverse effects of vasopressin when used to manage bleeding esophageal varices. Vasopressin causes widespread vasoconstriction to reduce portal pressure and bleeding. However, this generalized vasoconstriction can also affect the coronary arteries, leading to decreased blood flow to the heart muscle, potentially causing myocardial ischemia, reduced blood supply to the heart. Therefore, monitoring for signs of chest pain, changes in ECG, or other indicators of cardiac compromise is crucial. Hypoglycemia, peripheral edema, and hypernatremia are not primary or common severe adverse effects associated with vasopressin infusion. Always remember that vasopressin constricts all vessels, and the heart is particularly vulnerable to reduced blood flow, making cardiac monitoring a top priority. Question 14. A nurse is caring for a client with a history of intravenous drug use who is admitted with infective endocarditis. The client develops sudden severe dyspnea, pleuritic chest pain, and hemoptysis. The nurse suspects which of the following complications? A. Pericardial effusion. B. Myocardial infarction. C. Pulmonary embolism. D. Aortic dissection. Answer: C. Pulmonary embolism. This question tests the nurse's ability to identify a common and serious complication of infective endocarditis, especially in clients with a history of intravenous drug use. Infective endocarditis, particularly involving the tricuspid valve, common with 4 drug use, can lead to vegetation, clumps of bacteria and platelets, breaking off and traveling through the venous system to the pulmonary circulation, causing a septic pulmonary embolism. Sudden severe dyspnea, pleuritic chest pain, and hemoptysis, coughing up blood are classic symptoms of a pulmonary embolism. While pericardial effusion, myocardial infarction, and aortic dissection are cardiac emergencies, they do not typically present with this specific triad of symptoms, nor are they as directly linked to infective endocarditis in this manner. When a client with infective endocarditis shows acute respiratory symptoms and chest pain, always consider a pulmonary embolism from detached vegetation. Question 15. A client with Addison's disease is prescribed hydrocortisone. The nurse should instruct the client to report which of the following symptoms immediately? A. Weight gain of 2 pounds in a week. B. Swelling in the ankles. C. Darkening of skin pigmentation. D. Weakness, dizziness, and extreme fatigue. Answer D. Weakness, dizziness, and extreme fatigue. This question assesses the nurse's understanding of Addison's disease management and the early signs of an impending adrenal crisis, which is a life-threatening emergency. Hydrocortisone replaces the deficient cortisol, but inadequate dosing or increased stress can precipitate an adrenal crisis. Weakness, dizziness, and extreme fatigue are classic early symptoms of insufficient cortisol, indicating a potential impending crisis, which requires immediate medical attention and increased hydrocortisone dosage. Weight gain, ankle swelling, and darkening of skin pigmentation, hyperpigmentation, are generally associated with either Cushing's syndrome, from too much steroid E, or chronic Addison's disease itself, but not an acute crisis requiring immediate report. Always teach clients with Addison's disease to recognize and report signs of insufficient cortisol immediately, as an adrenal crisis can rapidly become fatal. Question 16. A nurse is caring for a client with an acute exacerbation of multiple sclerosis, MS, who reports increasing muscle spasticity and difficulty with transfers. The client is prescribed baclofen. Which of the following is the most important teaching point for this client regarding baclofen? A. Take the medication on an empty stomach to enhance absorption. B. Avoid abrupt discontinuation of the medication. C. Report any increase in appetite or weight gain. D. Increase fluid intake to prevent constipation. Answer B. Avoid abrupt discontinuation of the medication. This question tests the nurse's knowledge of important safety considerations for baclofen, a central nervous system depressant used to reduce muscle spasticity. Abrupt discontinuation of baclofen can lead to severe withdrawal symptoms, including hallucinations, seizures, and rebound spasticity, which can be life-threatening. Therefore, it is crucial to emphasize the importance of gradually tapering the medication under medical supervision. Baclofen can be taken with food, and while constipation can be a side effect, requiring increased fluid intake, and appetite/weight changes can occur, the most critical safety teaching relates to avoiding sudden cessation due to severe withdrawal risks. Always stress that abrupt stopping of baclofen can have dangerous consequences, requiring a careful tapering process. Question 17. A client with a traumatic brain injury has an intracranial pressure, ICP, of 18 mm of mercury. The nurse notes a Glasgow Coma Scale, GCS, score change from 10 to 8. Which of the following is the priority nursing action? A. Administer a prescribed osmotic diuretic, e.g., mannitol. B. Document the findings and continue monitoring. C. Reposition the client with the head of the bed flat. D. Administer a prescribed opioid for pain. Answer. A. Administer a prescribed osmotic diuretic, e.g., mannitol. This question assesses the nurse's ability to recognize and prioritize interventions for increasing intracranial pressure, ICP, and neurological deterioration. An ICP of 18 mm of mercury is at the higher end of normal. Normal is 5 to 15 mm of mercury, and a drop in GCS from 10 to 8 signifies significant neurological decline, indicating worsening cerebral edema and rising ICP. The priority intervention is to immediately reduce ICP, which an osmotic diuretic like mannitol can achieve by drawing fluid from the brain tissue into the vascular space. Documenting the findings without intervention is insufficient. Repositioning with the head flat would increase ICP, and an opioid could mask neurological changes and depress respirations, further increasing ICP. Always remember that a declining GCS score with elevated ICP is a medical emergency requiring rapid intervention to prevent further brain damage. Question 18. A nurse is caring for a client with a new colostomy. The client is tearful and refuses to look at the stoma. Which of the following is the most appropriate initial nursing action? A. Provide the client with educational materials about colostomy care. B. Ask the client to describe feelings about the colostomy. C. Reassure the client that feelings of distress are normal. D. Demonstrate how to change the colostomy bag. Answer B. Ask the client to describe feelings about the colostomy. This question tests the nurse's ability to apply therapeutic communication and prioritize psychosocial care in a client facing a significant body image change. When a client refuses to engage with their colostomy and is visibly distressed, the most appropriate initial action is to open a dialogue and allow the client to express their feelings. This demonstrates empathy and creates an opportunity to assess their perception and readiness for learning. Simply providing education or demonstrating care before addressing their emotional state will likely be ineffective. Reassurance is helpful, but exploring their feelings first allows for more targeted support. Always remember, when a client is showing emotional distress related to a new body image change, the first step is to assess their feelings and perception before jumping to education or reassurance. Question 19. A nurse is caring for a client receiving total parenteral nutrition, TPN. The nurse notes the TPN bag is empty, and the new bag is not yet available from the pharmacy. The client's next dose is overdue by 30 minutes. Which of the following is the most appropriate nursing action? A. Administer a bolus of 0.9% sodium chloride. B. Hang a bag of 5% dextrose in water, D5W. C. Discontinue the TPN line until the new bag arrives. D. Administer a bolus of 25% dextrose in water. Answer B. Hang a bag of 5% dextrose in water, D5W. This question assesses the nurse's understanding of managing TPN interruptions and preventing complications, specifically hypoglycemia. TPN solutions are highly concentrated with glucose. Abruptly stopping TPN, even for a short period, can cause rebound hypoglycemia due to the body's continued high insulin production. To prevent this, a temporary intravenous infusion of dextrose solution, typically 10% or 5% dextrose in water, should be administered at the same rate as the TPN until the new bag arrives. A bolus of 0.9% sodium chloride or discontinuing the line would not prevent hypoglycemia. A bolus of 25% dextrose is usually for severe hypoglycemia, not a preventative measure in this scenario, and might lead to hyperglycemia if not carefully monitored. Always remember, if TPN is delayed, hang a dextrose solution to prevent dangerous hypoglycemia. Question 20. A client with a history of alcohol use disorder is admitted with acute pancreatitis. The client suddenly becomes agitated, confused, and experiences tactile hallucinations. The nurse observes tremors and diaphoresis. Which of the following medications should the nurse anticipate administering? A. Morphine sulfate. B. Lorazepam. C. Haloperidol. D. Thiamine. Answer B. Lorazepam. This question tests the nurse's ability to recognize and appropriately manage alcohol withdrawal delirium, a life-threatening complication in clients with alcohol use disorder. The symptoms described, agitation, confusion, hallucinations, tactile, tremors, and diaphoresis, are classic signs of delirium tremens, DTs. Benzodiazepines, such as lorazepam, are the first-line treatment for alcohol withdrawal due to their ability to calm the central nervous system, prevent seizures, and manage the autonomic instability. While thiamine is important to prevent Wernicke-Korsakoff syndrome, it does not acutely manage withdrawal symptoms. Haloperidol might be used for severe agitation or psychotic features but typically after benzodiazepines, and morphine is not indicated for withdrawal. Remember, in alcohol withdrawal, benzodiazepines are crucial to prevent progression to delirium tremens and seizures. Question 21. A nurse is caring for a client with an external ventricular drain, EVD, in place. The nurse observes a sudden, significant increase in the amount of cerebrospinal fluid, CSF, drainage and a decrease in the client's blood pressure. Which of the following is the priority nursing action? A. Notify the healthcare provider immediately. B. Elevate the head of the bed to 45 degrees. C. Clamp the EVD for 30 minutes. D. Administer a prescribed osmotic diuretic. Answer: A. Notify the healthcare provider immediately. This question assesses the nurse's understanding of EVD management and recognition of a potentially catastrophic complication. A sudden, significant increase in CSF drainage from an EVD, especially coupled with a decrease in blood pressure, can indicate a sudden cerebral decompression leading to a rapid shift in brain tissue and potential brainstem herniation. This is a critical emergency requiring immediate medical evaluation. Elevating the head of the bed might worsen the pressure gradient, and clamping the EVD could cause a rapid increase in intracranial pressure if the increased drainage was a compensatory mechanism. Administering a diuretic is not indicated for this specific scenario. The priority is to inform the healthcare provider immediately to guide further intervention. When an EVD output suddenly changes dramatically with systemic vital sign changes, assume a severe neurological emergency and seek immediate medical help. Question 22. A nurse is educating a client with chronic obstructive pulmonary disease, COD, about home oxygen therapy. The client reports confusion regarding the correct flow rate. Which statement indicates the client needs further teaching? A. I will use 2 liters per minute of oxygen during the day and increase it to 4 liters when I feel short of breath. B. I will not change the oxygen flow rate without talking to my doctor. C. I understand that oxygen can be a fire hazard, so I will keep it away from open flames. D. I will wear my oxygen during exercise and sleep as prescribed. Answer: A. I will use 2 liters per minute of oxygen during the day and increase it to 4 liters when I feel short of breath. This question tests the nurse's understanding of safe oxygen administration in clients with COPD. For clients with chronic CO2 retention, such as many with COPD, increasing oxygen flow rates can suppress their hypoxic drive to breathe, leading to hypoventilation and CO2 narcosis. Oxygen flow rates should be precisely prescribed and not arbitrarily adjusted by the client, even if they feel short of breath, without consulting their healthcare provider. The other statements reflect correct understanding regarding not changing the flow rate, fire safety, and using oxygen as prescribed during activity and sleep. Always reinforce that for COPD clients, oxygen is a drug, and the prescribed flow rate must be strictly followed, as too much oxygen can be dangerous. Question 23. A nurse is caring for a client with severe acute pancreatitis. The client reports worsening abdominal pain that radiates to the back, and the nurse notes Cullen's sign, bluish discoloration around the umbilicus, and Gray-Turner's sign, bluish discoloration of the flanks. Which of the following is the most important nursing intervention? A. Administer a prescribed opioid analgesic. B. Insert a nasogastric tube to low intermittent suction. C. Assess for signs of hypovolemic shock. D. Prepare for immediate surgical debridement. Answer: C. Assess for signs of hypovolemic shock. This question tests the nurse's ability to recognize severe complications of acute pancreatitis and prioritize interventions. Cullen's sign and Gray-Turner's sign are indicators of retroperitoneal hemorrhage and pancreatic necrosis, both of which suggest severe, necrotizing pancreatitis. This massive inflammation and hemorrhage can lead to significant fluid shifts and blood loss into the retroperitoneal space, causing severe hypovolemic shock. Therefore, the most important nursing intervention is to immediately assess for signs of shock, e.g., hypotension, tachycardia, decreased urine output, and initiate fluid resuscitation as prescribed. While pain management and NG tube insertion are part of pancreatitis care, they are not the priority over managing a life-threatening shock state. Surgical debridement might be needed later but is not the immediate priority. Remember, the presence of Cullen's or Gray-Turner's sign indicates severe internal bleeding and fluid shifts, making shock assessment and management the absolute priority. Question 24. A client with a history of depression is admitted to the psychiatric unit with suicidal ideation. The client states, "I just want to end it all, but I don't have the energy to do anything." The nurse notes the client has recently started an antidepressant medication. Which of the following is the most concerning statement for the nurse? A. I've started feeling a little better and have more energy. B. I still feel hopeless, but I am sleeping better now. C. I don't think this medication is helping my mood at all. D. My appetite has improved, and I'm eating more. Answer. A. I've started feeling a little better and have more energy. This question assesses the nurse's critical understanding of the paradoxical risk of suicide during antidepressant therapy. While feeling better is generally positive, for clients with severe depression and suicidal ideation, a sudden increase in energy without a corresponding improvement in mood can be extremely dangerous. Antidepressants can sometimes increase energy levels before improving mood, giving a previously lethargic client the physical energy to act on suicidal thoughts. The nurse must be highly vigilant during this period. The other statements, while indicating different levels of medication response, do not carry the same immediate high risk for suicidal action. Always remember that a sudden surge of energy in a severely depressed client starting antidepressants, especially if mood hasn't fully lifted, requires heightened vigilance for suicide risk. Question 25. A client with diabetic ketoacidosis, DKA, has a blood glucose level of 750 mg per deciliter, pH of 7.20, and is receiving a continuous insulin infusion. The client's serum potassium level is 3.0 milliequivalent/L. Which of the following is the most appropriate nursing action? A. Increase the rate of the insulin infusion. B. Administer intravenous potassium chloride. C. Administer a bolus of intravenous bicarbonate. D. Discontinue the insulin infusion. Answer, B. Administer intravenous potassium chloride. This question tests the nurse's understanding of managing electrolyte imbalances, specifically hypokalemia, during DKA treatment. While DKA causes hyperglycemia, the insulin infusion drives glucose and potassium into the cells, leading to a rapid drop in serum potassium levels. A serum potassium of 3.0 milliequivalent/L is low, normal 3.5-5.0 milliequivalent/L, and can cause life-threatening cardiac dysrhythmias. Therefore, even with a high blood glucose, it is crucial to administer intravenous potassium chloride to correct the hypokalemia before it worsens, often while continuing the insulin infusion to address the DKA. Increasing insulin or discontinuing it without addressing potassium would be dangerous. Bicarbonate is rarely used in DKA unless the pH is extremely low. Always remember that potassium levels must be carefully monitored and corrected during DKA treatment, as insulin infusion can quickly cause severe hypokalemia, which is a major cardiac risk. Question 26. A nurse is caring for a client undergoing peritoneal dialysis. The client reports abdominal pain and the nurse observes cloudy dialysate outflow. Which of the following is the most appropriate initial nursing action? A. Administer a prescribed opioid analgesic for pain. B. Obtain a dialysate outflow sample for culture. C. Increase the dwell time to improve pain management. D. Reposition the client to facilitate drainage. Answer: B. Obtain a dialysate outflow sample for culture. This question assesses the nurse's ability to recognize and respond to the primary complication of peritoneal dialysis, peritonitis. Cloudy dialysate outflow, combined with abdominal pain, is the hallmark sign of peritonitis, which is an infection of the peritoneal cavity. The most appropriate initial action is to obtain a sample of the cloudy dialysate outflow for culture and sensitivity testing to identify the causative organism and guide antibiotic therapy. While pain management is important, treating the infection is the priority. Increasing dwell time or repositioning will not address the infection. Early identification and treatment of peritonitis are crucial to prevent severe complications and preserve the integrity of the peritoneal membrane. Always remember that cloudy dialysate is a red flag for peritonitis, requiring prompt culture to guide treatment. Question 27. A client with a history of atrial fibrillation is prescribed warfarin. The client takes several herbal supplements daily, including St. John's wort, ginseng, and garlic. Which of the following statements indicates a need for immediate intervention by the nurse? A. I started taking ginseng to help with my energy levels. B. I use garlic supplements to boost my immune system. C. I take St. John's wort for my mood, but I haven't told my doctor. D. I only take these herbal supplements when I remember. Answer: C. I take St. John's wort for my mood, but I haven't told my doctor. This question tests the nurse's understanding of dangerous drug-herb interactions, specifically with warfarin, an anticoagulant. St. John's wort is a potent enzyme inducer that can significantly decrease the effectiveness of warfarin, increasing the risk of blood clots and stroke in a client with atrial fibrillation. The client's admission of taking it without the doctor's knowledge is particularly concerning because the healthcare provider is unaware of this critical interaction. Ginseng can increase bleeding risk, and garlic can have antiplatelet effects, but St. John's wort's interaction with warfarin's efficacy is typically considered a higher concern for stroke risk in atrial fibrillation. Irregular intake is problematic but less acutely dangerous than an unknown, severe drug interaction. Always emphasize the importance of reporting all supplements to the healthcare provider, especially when taking anticoagulants, as herbal remedies can significantly alter drug effectiveness and safety. Question 28. A client with severe burns covering 40% of the total body surface area, TBSA, is in the emergent phase. The nurse monitors for which of the following signs as the most critical indicator of fluid resuscitation effectiveness? A. Capillary refill less than 3 seconds. B. Urine output of 30 to 50 ml/hour. C. Heart rate between 90 to 110 beats/min. D. Blood pressure 90/60 mmHg or higher. Answer: B. Urine output of 30 to 50 ml/hour. This question assesses the nurse's knowledge of fluid resuscitation monitoring in severe burn clients. In the emergent phase of burn injury, massive fluid shifts occur due to increased capillary permeability, leading to significant plasma loss and risk of hypovolemic shock. The most critical and reliable indicator of effective fluid resuscitation is adequate urine output, typically 0.5-1 ml/kg/hr for adults, or 30 to 50 ml/hour for most adults. This directly reflects renal perfusion and systemic fluid status. While other vital signs like heart rate and blood pressure are important, they can be influenced by many factors and may not accurately reflect cellular perfusion as well as urine output. Capillary refill is often unreliable in burn clients due to tissue damage. Always remember that urine output is the gold standard for assessing fluid resuscitation adequacy in burn clients, indicating that vital organs are being perfused. Question 29. A client is admitted with a suspected pheochromocytoma. The nurse understands that which of the following is the most critical intervention to prepare for prior to surgical removal of the tumor? A. Administering a beta blocker to control heart rate. B. Implementing a low-sodium, low-fat diet. C. Initiating alpha-adrenergic blockade. D. Preparing for 24-hour urine collection for catecholamines. Answer: C. Initiating alpha-adrenergic blockade. This question tests the nurse's advanced knowledge of managing pheochromocytoma, a tumor that secretes excessive catecholamines, epinephrine and norepinephrine. Prior to surgical removal, adrenalectomy, it is absolutely critical to stabilize the client's blood pressure and prevent a hypertensive crisis during surgery. This is achieved by administering alpha-adrenergic blockers, e.g., phenoxybenzamine or prazosin, for 10 to 14 days preoperatively to block the effects of the circulating catecholamines and prevent severe hypertension. Beta blockers may be added after alpha blockade is established, never first, as unopposed alpha stimulation can worsen hypertension. A low-sodium, low-fat diet is not specific pre-op care, and while 24-hour urine collection is for diagnosis, it's not a preoperative intervention. Always remember that alpha-adrenergic blockade is the cornerstone of preoperative preparation for pheochromocytoma to prevent a hypertensive crisis during surgery. Question 30. A client with a severe exacerbation of asthma is admitted to the emergency department. The client is experiencing inspiratory and expiratory wheezing, accessory muscle use, and is tachypneic. Suddenly, the wheezing disappears, and the client's respiratory effort decreases. Which of the following is the most concerning finding? A. The client's reported decrease in anxiety. B. Decreased respiratory rate from 38 to 22 breaths/min. C. Absent breath sounds with continued accessory muscle use. D. Oxygen saturation improving from 88% to 92%. Answer: C. Absent breath sounds with continued accessory muscle use. This question tests the nurse's ability to recognize a critical and ominous sign in a client experiencing an acute asthma exacerbation. The sudden disappearance of wheezing, especially when accompanied by continued accessory muscle use and decreased respiratory effort, indicates a silent chest, a sign of severe airway obstruction and impending respiratory failure. The airways are so constricted that air movement is no longer sufficient to produce wheezing sounds, and the client is tiring out. This is a medical emergency requiring immediate intervention, e.g., intubation. While decreased respiratory rate might seem positive, in this context it signifies exhaustion. Improved oxygen saturation can be misleading if ventilatory effort is failing, and decreased anxiety might be due to hypoxia. Always remember, a silent chest during an asthma attack means the client is no longer moving enough air to even wheeze, indicating impending respiratory arrest. Question 31. A nurse is conducting discharge teaching for a client with newly diagnosed glaucoma. The client asks about activities to avoid. Which of the following activities should the nurse instruct the client to avoid? A. Reading fine print for extended periods. B. Using over-the-counter decongestants. C. Participating in aerobic exercise. D. Driving at night. Answer: B. Using over-the-counter decongestants. This question assesses the nurse's knowledge of important contraindications for clients with glaucoma, particularly related to common medications. Many over-the-counter decongestants contain sympathomimetic agents, e.g., pseudoephedrine, phenylephrine, that can cause pupillary dilation, mydriasis. In clients with narrow-angle glaucoma, or those susceptible to it, pupillary dilation can block the drainage of aqueous humor, leading to a sudden, dangerous increase in intraocular pressure, acute angle closure glaucoma. Therefore, clients with glaucoma should avoid these medications. Reading, aerobic exercise, and night driving, though potentially challenging due to vision loss, are not typically contraindicated as they do not directly increase intraocular pressure. Always remind clients with glaucoma to check the labels of all over-the-counter medications and avoid those that can cause pupillary dilation. Question 32. A client is admitted with new onset of Guillain-Barré syndrome, GBS. The nurse assesses the client and finds bilateral lower extremity weakness and diminished deep tendon reflexes. Which of the following is the most important assessment to perform continuously? A. Level of consciousness. B. Pain level. C. Respiratory effort. D. Bowel sounds. Answer, C. Respiratory effort. This question evaluates the nurse's ability to prioritize assessments for a client with Guillain-Barré syndrome, a demyelinating disorder that causes ascending paralysis. While weakness is an early sign, the most critical concern in GBS is the potential for respiratory muscle paralysis, which can lead to life-threatening respiratory failure. The nurse must continuously monitor the client's respiratory effort, rate, depth, oxygen saturation, and vital capacity to detect any signs of impending respiratory compromise, which would necessitate mechanical ventilation. Level of consciousness, pain, and bowel sounds are important but not as immediately life-threatening as respiratory muscle involvement. Always remember that the ascending paralysis in GBS can rapidly affect the diaphragm and intercostal muscles, making respiratory assessment the absolute priority. Question 33. A nurse is preparing to administer intravenous immunoglobulin, IVIG, to a client with an autoimmune disorder. Which of the following is the most critical intervention for the nurse to perform prior to the infusion? A. Administer a test dose of IVIG. B. Pre-medicate with acetaminophen and diphenhydramine. C. Obtain a baseline blood pressure and heart rate. D. Ensure 2 large bore 4-access sites are available. Answer, B. Pre-medicate with acetaminophen and diphenhydramine. This question assesses the nurse's knowledge of essential safety measures for IVIG administration. IVIG, a blood product, carries a significant risk of infusion-related reactions, ranging from mild, fever, chills, headache, to severe, anaphylaxis. To minimize these reactions, it is common and critical practice to pre-medicate the client with acetaminophen for fever/headache, and an antihistamine like diphenhydramine to reduce histamine-mediated reactions. 30 to 60 minutes before the infusion. While obtaining baseline vital signs is necessary and having adequate 4-access is good practice, pre-medication directly addresses the high likelihood of infusion reactions. Test doses are generally not performed for IVIG. Always remember that IVIG infusions often require pre-medication to prevent adverse reactions and ensure client comfort and safety. Question 34. A client is admitted with suspicion of acute angle closure glaucoma. Which of the following assessment findings would be most concerning to the nurse? A. Gradual loss of peripheral vision. B. Painless, blurred vision. C. Severe eye pain, sudden blurred vision, and fixed, dilated pupil. D. Redness and itching of the conjunctiva. Answer: C. Severe eye pain, sudden blurred vision, and fixed, dilated pupil. This question tests the nurse's ability to differentiate between types of glaucoma and recognize the acute, emergent signs of angle closure glaucoma. Acute angle closure glaucoma is a medical emergency caused by a sudden blockage of aqueous humor outflow, leading to a rapid and severe increase in intraocular pressure. This typically presents with sudden, excruciating eye pain, blurred or halo vision, and a fixed, dilated pupil. Gradual loss of peripheral vision and painless blurred vision are more characteristic of open-angle glaucoma, which is chronic and less acute. Redness and itching are more indicative of conjunctivitis. Recognizing these distinct symptoms of acute angle closure glaucoma is critical for prompt treatment to prevent permanent vision loss. Always remember, sudden eye pain and a fixed, dilated pupil are hallmarks of an acute angle closure glaucoma emergency. Question 35. A client undergoing hemodialysis suddenly develops shortness of breath, chest pain, and a feeling of impending doom during the treatment. The nurse notes hypotension and tachycardia. Which of the following actions is the most appropriate initial response? A. Administer a prescribed PRN oxygen supplement. B. Slow the hemodialysis blood flow rate. C. Discontinue the hemodialysis treatment immediately. D. Place the client in Trendelenburg position. Answer: C. Discontinue the hemodialysis treatment immediately. This question assesses the nurse's ability to identify and respond to a life-threatening complication during hemodialysis, an air embolism. The sudden onset of shortness of breath, chest pain, feeling of impending doom, hypotension, and tachycardia during hemodialysis are classic signs of an air embolism, air entering the bloodstream. The most immediate and critical intervention is to discontinue the hemodialysis treatment, clamp the client's blood lines, and then place the client in a left lateral Trendelenburg position to trap air in the right ventricle. Administering oxygen is supportive but not primary, and simply slowing the blood flow rate is insufficient to manage an active air embolism. Always remember that if an air embolism is suspected during hemodialysis, stopping the treatment and positioning the client are the absolute first priorities to prevent further air entry and minimize its impact.